We are here with Dr. Edward Dickerson, facial plastic surgeon, for his summer radio series on WIDU. And we're here also today with Jesse McNeely, registered nurse. And we are here today to speak about surgical and non-surgical facial plastics.
Hey, thank you very much, Liza. It's fabulous. You know, we've had a great opportunity to do these series, and I'm so happy to have Jesse McNeely, our RN, who is become such an awesome assistant in the operating room, circulating nurse, and some of the other fabulous things that we've got going on. So it's really going to be nice to not only hear from the doctor standpoint, but also from my nurse injector. And so, Jesse, you know, you've been with us for about how long? Less than a year now, and we've had a great opportunity to grow not only our surgical practice, but we're talking about non-surgical stuff. So tell me some of those things that your clients come and talk to us about, you know, when they're asking, and they want something, they've got that high school reunion, let's say, in a couple of weeks. What are they asking you about, Jess?
Well, they come in and they first come in for a consultation, and one of the first things that they want to talk about is that they feel like they look tired or angry when they're not, and they want a solution for that. They want to look more rested, they want to be more approachable, and they want to know, what can I do non-surgically to, in a conservative manner, try to fix these things with my face, and then, we'll work from there as far as non-surgical to surgical.
Now, one of the funnest things I know my audience comes to see me for, and we try to break it down for us, Liza, we talk about wrinkle blockers and wrinkle fillers. So you've heard them come into our office and say, hey, people are always saying that I look mad, or I look angry, or I got these hatchet lines in my forehead. And so for those of our listening audience, if you kind of think about those wrinkles above your eye, whether they're your horizontal forehead or your vertical ones in between your brow, or even what we call those crow's feet. Some of y'all got paws, if you will. It's all about blocking those wrinkles with a wrinkle blocker, because those are wrinkles of animation. Now, Jesse, we even talk about the other thing is wrinkle fillers, and those are those wrinkles that go below the eyes, or right here with the nasolabial fold, or sometimes those puppet lines. Do you have a particular filler that you like better than the others? Let's just talk about wrinkle fillers. Okay. What kind of filler do you like or you've used in your experience the most?
I like to use the Radius for the smile lines and the marionette lines below the chin. Gravity is not always our friend, and as our cheeks kind of fall, then we end up with the creases on the either side of our mouth. And when we smile, we see those deviations or deficits, and those can be filled in very easily with a product called Radius.
Now, how we get a lot of questions about Radius. Mm-hmm. Tell them, our audience, how long does that Radius last?
It can last up to a year, but I think for most people it lasts about 9 months. Okay,
great. And give me an idea how much that would cost, let's say, for one syringe, if we're trying to take care of puppet lines or want to build those cheeks out. What does one syringe cost for us?
$700.
Okay, that's actually a pretty great price point, especially, once again, that's non-surgical. And do they have to wait that long to see a response?
No, the response is immediately. So when you come in for your appointment and you get your filler done, you're going to leave with the result that you came in.
Gotcha.
Mm-hmm.
So, Liza, what's up next for our wrinkle blockers? What's been the biggest thing for us as far as what we're doing? What are the clients coming in? What are the questions they want to know about some of the wrinkle blockers? And pretty much what are the ones that are used at our facility, if you will?
So a lot of our clients will come in and they'll ask specific questions about Xeomin, how they can look less tired, as you mentioned before, Jesse. They will also, their ultimate goal is to come in and leave looking younger than they were before. And a lot of times the solution might be to actually add something that was not there before.
We have, the ultimate liquid facelift, as we call it. We use a filler that's kind of like a hair gel consistency for the lips, and it gives them instant lips. And we've talked about some of the thicker ones for the radius. And then, of course, we have our world-famous wrinkle blockers. Those are essentially Botox or Dysport. We use a lot of Xeomin in our practice, and essentially that's usually the rules of 4. So I say it usually will take us about 4 seconds to do an area. It kicks in about 4 days, and it can last up to 4 months. So that's always a great opportunity. It's minimal. People don't even know that they've had it done. They're very excited, and especially with our wrinkle blockers, because it's a gradual effect, it does really, really well, and it doesn't give them that worked-on look. As you said before, Jesse, we just want them to look rested, if you will. Tell us about, one of your favorite things is lips. So what do we do for the lady that comes in and she says, look, I put on lipstick with a straight line. Now, I used to have lips. Kind of what conversation are you having with them?
Well, a lot of times I'll have them show me a picture of what they would like their lips to look like. Or they may say, it might be obvious that I just want to have more definition. I want to be able to see the bow that's not there any longer. Or my top lip is fuller than my lower lip. I'd like for that to be more symmetrical. And the product that we like to use for that is Bellatero. Really enjoy doing lips. It's one of my favorite fillers to do. People are so pleased and they smile so big when they leave with their new lips.
Yeah, I mean, it's amazing, how people just feel confident and once again are able to rejuvenate even a small part of their face. And if we remove some of the distraction lines with the Radius or the Juvederm or any other fillers that we have, and sometimes we'll even use fat and recycle that if we're doing a procedure. But if we're taking away those shadows or those low lights and we're giving them more highlights, and in the case of the lips, if we don't have them boxed in with those parentheses and really rotate them up. And Liza, you've seen folks come in sometimes a little bit off balance from other practices where they're just doing their top lip and they almost look like they have that fish look, if you will. So for those out there that are considering getting their lips done, it's all about balance. And if you kind of look in the mirror, most individuals' lower lip is a little bit more fuller than their top lip. And so we want to maintain that ratio. Once again, if we're just treating upper lip, it almost looks like you're creating a shade pattern over their mouth, and they really start getting that disproportionate look. Anything else that you notice about when we're doing injectables in our practice?
What can we offer outside of just what's in the needle?
Well, there are several things that we can talk about. One of them is a non-invasive procedure called Thermic Smooth. It feels like getting a hot stone massage. It is a procedure that you could have done during your lunch break from work. Come in about every 2 weeks for, I think there's a four appointment series for that. It can tighten skin. It can reduce loose skin, make things smoother, and also reduce fat in those areas.
Yeah, we've had some great success with that. So those are some of the individuals don't even want, the option of breaking the skin with a needle. And using the radio frequency energy allows us to, once again, melt the fat, and we'll see those changes over a 3-month period. And then, for those individuals who want more volume, as you asked in another place, we can actually recycle some fat, if you will. And the great thing about that is putting those two together of tightening the bed sheet and giving us some volume. It's almost that we do like a push-up bra to the face. And but not only can we just use this on the face, Jesse, you've seen us use this on the skin of, let's say, the upper chest area. We've had great results of using the non-invasive around the arms and really improving that cottage cheese look at the thigh. That's always a tough one. Or we have some individuals that, let's say, are having a significant amount of friction in their inner thighs. Without liposuction, this is just another tool for us to decrease that fat deposit, if you will. Or if they don't want the fat itself, we can always move it and put it in their lips or their face.
Right.
So that's been fantastic for us. But also talk to them about we talked about the Thermic Smooth. What is your take on the last couple of years of us using the Thermic Tight?
Thermic Tight is amazing. If for someone that's not ready to have an invasive surgical procedure where there's cutting, because there's no cutting with the Thermic Tight. It's small, little holes, no bigger than if you had a shot given with a hypodermic needle, and there's a hole behind each ear and one under the chin, just large enough for a probe to slide in there. This energy, this radio frequency, the heat is measured from the inside of your body and the outside using an infrared camera, so it's well controlled. We suck out the fat that's between the muscle and the skin, and then as that device heats and is pulled away, then that pulls the skin down tight over the muscle and gives it a nice tight jawline or appearance. This can be used other than just the face as well. It can be used to tighten the skin under your arms. It can be used on your thighs. It's even been used sometimes in the breast area.
Okay, so to recap here, ThermiSmooth is going to be a topical treatment.
Correct.
Okay, so this is just to the surface of the skin, and we can do that to the face, we can do that to the body.
Mm-hmm.
Okay, and there's no downtime for this. For Thermic Tight, it's minimally invasive, so it just goes under the surface of the skin. We can also treat the face and
anywhere we want to tighten up
Anywhere?
skin.
Okay.
Anywhere we want to tighten up skin.
Okay.
And that's been really, really fabulous, especially when we'll combine it, as Jesse says, with liposuction, or let's say an individual who's had a facelift 5 or 10 years ago needs a touch-up. We don't have to necessarily go back to the big operating room, if you will. We could use this small little probe that's probably, as big as smaller than a Q-tip, if you will, just a shaft. And it makes it real easy. We do the treatment. It probably takes us about an hour to do. There's no muss. There's no fuss. We also give them a little bit of sedation medicine like Valium. So for the most part, most of our patients are taking a nice nap while we're doing the treatment. It's no pain after we get the anesthesia on board. They're very comfortable.
okay, and so that's for Thermic Tight that we would just need a little bit of sedation.
Correct. Yeah, for the
Okay.
ThermiSmooth, you're good to go, just as you said. They come in, they do the treatment over to lunch, they're done.
Cool. Okay, so how long can we expect results to last?
Well, usually I will tell the client that if, let's say, we're going to compare the facelift to the Thermic Tight, I usually will tell them it's about half the cost. It basically lasts for about half the time. So if a facelift lasts us up to 10 years, we'd say the Thermic Tight may last us 5 years. However, that's all ensuring that the patient's maintaining their height and weight as well. If they're out there just eating cheeseburgers for breakfast, we could have a little bit of an issue. So usually we talk about in halves. The ThermiSmooth is nice because you'll get about, once again, 2 to 3 years out of that. But once again, there's no downtime. There's no loss of work. And once again, those individuals are able to work out. There's no disruption of their daily habits, if you will. So, I mean, it's once again, we have a lot of tools in our practice and a lot of individuals. So no matter what their anxiety level, concern, they're all safe, and we have something to fit everybody's budget.
Great. So we have something for everybody, and we're sure to find something that you'll be comfortable with. If you have decided that you would like to find out about our surgical options, we offer the entire range. So we're going to talk today about our most popular surgical procedures for the face. And Dr. Dickerson, what would you say is the absolutely most popular procedure that people request?
The most popular procedure that our clients request as a facial plastic surgeon, I would have to say, is the eyelid surgery, either upper or lower. And there's different types. The gentlemen like it because they want to take a little bit of that hooding out. We don't want to necessarily girlify that face, but the neat thing is we can hide that incision very, very well. For my ladies, there's no question that the upper as well as the lower are probably our most popular. Would you agree, Jesse?
I do.
And, the neat thing about that is both of those procedures are done in less than an hour. The lower eyelid, we kind of, in those consultations, we talk about pillows underneath the bedspread. And the neat thing about that is we can take those pillows out, or fat pads, if you will, plant them somewhere else, but we can get them without leaving a mark on their face. And, on that note, Jesse, tell me a little bit about what happens and share with our clients about what they should expect post-operatively.
Post-operatively, from having eyelid surgery, you will have some swelling and some bruising. The swelling, we give you medication for the swelling. The bruising only lasts a few days and before it starts turning the yellowish color that's very easily concealed with a concealer, makeup choice that you have to match your skin tone.
And, I will tell you, the eyelid surgery is once again one of the biggest things that we can change the client's appearance of themselves in the mirror and how they appear to the rest of them. And we have to take each one individually. So we make sure that there is not just excess skin of the upper eyelid, but we'll also evaluate whether or not their brow is in the right position. For those individuals that say have had trauma or what we call loss of nerve sensation via stroke or other reasons, we want to try to even those areas out so that when we're looking at a face, there's harmony to both sides. But one of the biggest things that we talk about, especially for different women of color, and so for my African American women, for them the lower blepharoplasty is much more common because of the bulging fat that they see, because of the shadow that's actually cast. Taking into consideration or the next group of patients, which is our Asian patient, who once again wants to consider what can we do with the Asian eye. And that's actually a very tricky one because a Japanese eye is not a Chinese eye, it's not a Thai eye or a Korean eye. And so once again, taking all those things into consideration to include the tapering of the eye, to include the webbing that's the little bit of extra fold towards the nose. And Jesse will be the first one to tell you that when we're talking about working on an Asian eye, we're not trying to westernize that eye. We're not trying to make it round eye. We are really just trying to turn the clock back and do what we call for some individuals, which is called a double eyelid surgery. And in a sense, form that small little crease that's just above the lashes so that a small amount of eyeshadow can be seen with the Asian eye to give it a more youthful eye versus trying to make it open and round like Little Orphan Annie. That is not an aesthetic result for that population. Anything else you want to add to the eyelid stuff?
I can say that that most patients can experience with eyelid surgery that it can take 5 to 10 years off the look of their face just doing their eyelids.
That's amazing. What about those individuals that are interested in possibly changing the shape of their nose?
Yes, so the nose job, the rhinoplasty, the schnoz fixer, if you will. There is a couple things that individuals will come, and they may have everything from a history of recent trauma, my soldiers who have been hurt during battle, or even those individuals who they want to change the shape of their nose, but their main problem is actually function. So we do look at function and form. So not only do we look at the outside of the nose, there's a thorough inspection of the inside of the nose, comparing those individuals who may have allergies or considering those individuals who have excess nosebleeds. We want to make sure we take care of that functional problem as well. And once again, it is all about harmony. Individuals will come, and I know a lot of them do, with their a perfect picture of an actress, and they say, I want that nose. And I said, that's nice, but it's not going to look good on your face. Those individuals, I give you a great tip. For those individuals out there that want to consider a nose job, there are a lot of free apps on your mobile devices called plastic surgery simulators. They are free, and you can literally take a picture of yourself and actually morph them. So when I'm doing a show, we'll use that little morphing device for them to, if you will, go shopping for their nose. And that gives them a really nice idea about, if I remove this hump, what will it do? If I make this nose more projected or less projected, what will that look like? Because really the nose out there is a three-dimensional tripod. If you move one leg of that tripod, the other leg is going to move. And so that's how I will do that consultation with them. That procedure itself is usually done while they're asleep. They come in that day, they go home that day. They will be flying their computer and doing their normal household chores even the next day. It's not a very painful operation. It will feel like somebody punched you in the nose pretty good. But for the most part, it's a small population, but those individuals usually do their research over months and years. This is usually not a whimsical or on the spot. This is not, hey, I'm going to try a little Botox. These individuals, once again, are very, very conscious about what's going on in the middle of their face. And being essentially the only double board certified facial plastic surgeon, we like to say that we're a leader in this area of our region to provide those clients with that. I know Jesse sees a lot of my stuff post-operatively, so what do those patients usually expect after surgery, Jesse?
They have swelling and bruising, and they understand that it's a process involved to get through that part of it. It's life-changing for most of them. A lot of their self-esteem and how they feel and how they project themselves to the world and to others is very important when it's the middle of your face, right, as you said. And it's just easy as going and getting a consultation, looking at what can be done with the nose you have and what you don't like about it, and it can change your life. It really can.
Oh, let me tell you, it's all about that face, about that face, about that face. Okay. So some of these newer generation lip implants that we actually use for our veteran injectable lip, whether it's the Bellotero or whether it's using the fat, the lip implant is amazing. It's very pliable. It's very kissable. It doesn't hurt. And literally the procedure takes probably less than a half an hour to do for both upper and lower. The patient is numb. They don't feel anything. Once again, a little sedation on board, and they immediately walk her out with those luscious lips. But here's the great thing is we can size them. So whether they have a wide lip or a narrow lip, want a little bit more fullness, want to correct some unevenness, we have that ability itself. So although Jessie is a great injector for our lips, she usually, after 2 or 3, the conversation comes up, well, what else can I do? So those lip implants have been fantastic for us.
Great. So on the topic of implants, is that something that we can do for fullness in other areas of the face, maybe for the cheeks, or maybe what about the chin?
Yes, we can do implants for the cheek and for the chin. And again, someone that's had a receding chin most of their life, this is something that is very connected to their self-esteem and self-worth. And it's a really simple procedure. It doesn't take that long. It's something we can do. We do have an operating room in our practice, by the way, that is fully accredited. So that means it meets par level with any hospital or ambulatory surgery center. So we're right there with them. This procedure does not take that long, maybe an hour at the most. So if you came in about 8 o'clock in the morning, you're generally home by lunchtime.
And I will tell you, Jesse, since we've actually used, once again, some of the newer generation implants, especially the cheek implants, that has made our facelifts look even better. So as we continue to mature, we'll lose some fat. The gravity monster wants to pull things down. If I am building up the structure, what we call the table, and it allows us to redrape the tablecloth, or in this case, the skin of the face, it once again gives us that opportunity to not only get some tension, but we get everything moving north. And that's actually been fantastic because, once again, everything is moving south for us. So when we have our consultations for a facelift, we will evaluate them for mid-face volume loss, because I don't care how much you pull, if you're not bringing back some of that volume, whether it's through an injectable or through a cheek implant, things may not turn out as well as we would like it to. Right. That doesn't mean we can't go back and put those in, but
so we can use implants to restore volume then in places where
with their bone structure, things have fallen, and even when you pull the skin back tight, if you've lost that volume there, then you may need an implant to fill that in, unless you want to continue to have fillers done.
So who's the right candidate for a facelift?
Well, usually my candidate generally is somebody who looks in the mirror and essentially is doing a lot of pulling on their neck and their chin, and they like what they see once they actually do that. It's usually somebody somewhere about middle age, but because we have so many non-surgical and minimally invasive opportunities that we've discussed before, whether it be wrinkle blockers, wrinkle fillers, Thermi Smooth, Thermi Tight, we're actually getting more and more people out of the operating room back into their busy life, if you will, by using those procedures that we've talked about. But for those individuals who have a lot of excess skin, a lot of damage to skin, we can't necessarily treat those with some of those things we just talked about. A lot of them that have the neck waddle, or a lot of them that have, severe jowls, if you will, those individuals are a must for those procedures. But because we have all those tools in the toolbox, we can pick out what's just right for them.
Wonderful. Thank you so much for joining us today, Dr. Dickerson and Jesse McNeely. At this point, I'd like to encourage all of you listeners to find out more. We have a wealth of information on our website for Fayetteville Plastic Surgery. It is fayplasticsurgery.com. That's F-A-Y plasticsurgery.com. Alternatively, you can check out Dr. D on his YouTube channel or on his Real Self profile. He has hundreds of videos, reviews, and answers to all of your questions. Of course, our concierge service at Fayetteville Plastic Surgery would love to help you set up a free consultation with Dr. Dickerson, and they can be reached at 323-3757. And Dr. D, would you like to sign off?
Thank you very much. Hey, this is Dr. D, and thank you for listening. We hope to see you soon.